Please join me in welcoming Dr. Devi Shetty, the chairman and founder at Narayana Hridayalaya, as well as Indu Bhushan, CEO of Ayushman Bharat himself. Gentlemen, morning. Thank you so much for taking the time out and joining in. Dr. Shetty, if I could begin the discussion with you, help us understand what's been the impact of Ayushman Bharat and hospital volumes, and do you think volumes would benefit very highly?
I strongly feel that it's a matter of time before there will be a big impact on the number of procedures done across the country. Of course, it's the early days yet, mainly because most hospitals are in little bit of a problem, not because of Ayushman Bharat. It's mainly because the other government-sponsored schemes and the insurance schemes are really not paying the hospital their dues on time. So the hospital financials are slightly affected, and that is the reason why there is no great enthusiasm by the hospitals to embrace Ayushman Bharat. And once this gets addressed, I think the number should pick up. You see, you have to realize that half the country's population could never dream of entering a private hospital. Now with the Ayushman Bharat, it is possible. The people who are never our customers are going to become customers now.
Okay, and who better than Dr. Indu Bhushan right here to understand and try and answer all those concerns. But Mr. Bhushan, I'll come to the point that Dr. Devi Shetty was making it just a bit. Firstly, on a larger scheme of things, help us understand what's the size and scale of Ayushman Bharat as of date.
Well, as you know that it covers 50 crore people, and so far in last 6 months we have benefited more than 18 lakh people already, and so all of these 18 lakh people, most of them actually have gone to the private sector, and we have right now more than 15,000 hospitals which are impaneled, and 50% of those are from the private sector. So private sector actually has been a good part of this story, and I fully agree with Dr. Devi Shetty that unless we have a rate which is viable and we pay the hospitals on time, the enthusiasm of the hospitals, private hospitals to join, even public hospitals to join, will be muted. And in this scheme, we want to make sure that the hospitals are paid on time. And so far in last 6 months, in general, we've not received any complaint from hospitals that payments are getting delayed. There are a couple of instances that we have heard about that, and we've followed up, and we've made sure that payments are done on time. Now, in terms of the increase in the footfalls, already we are seeing early days, as Dr. Devi Shetty says, but I have had interaction with some hospital chains, and they've informed me that because of Ayushman Bharat in last 6 months, the footfalls have increased by about 20% in their hospitals. So as Dr. Shetty mentioned, that we have opened the doors of private hospitals for the first time to the 40% poorest people in the country, and that is about 50 crore people, and obviously the volumes are going to increase slowly but surely.
All right. Dr. Shetty, do you think that margins on Ayushman Bharat pricing will pose a risk to overall margins in the sector?
See, every hospital, whether it is a private or a trust hospital, all of us have an obligation to take care of the underprivileged. So I agree that what Ayushman Bharat is paying is not what it costs to do the procedure. But then we all have an obligation, and it's not a large percentage of our workload, so we can manage. But we are hoping that in the years to come, the number of beneficiaries from this scheme will increase. When that happens, we definitely look for upward increase in the price. It won't be sustainable if we have to increase the number of these procedures. That the Ayushman Bharat scheme, Mr. Indu Bhushan and his team are aware, and they're working towards it. I'm hopeful of a upward increase at some point of time in the future. Yeah, I'm very hopeful.
Good morning. What is the outlook, in terms of the pricing of the various schemes on Ayushman Bharat? Do you think that at these levels, hospitals will be able to make decent margins?
Well, if you look at the whole package, we have some packages where there is a decent margin, and I have to admit that there are some packages where the margins are not there, or maybe in some cases it may not even be taking care of the marginal cost. And as Dr. Shetty mentioned, we are looking at it. We have a team and we are working with the Department of Health Research and DGHS to look at the packages and see if they can be rationalized. But if you look at the whole package where maybe you're getting making some money out of some packages, and some packages maybe you're losing money, probably overall hospitals are doing well, but we want to make sure that we are supporting the marginal cost, at least the marginal cost is covered, because I fully understand that unless we cover the marginal cost of all hospitals, they'll not be keen to join, and even if they join, they'll not be keen to provide that service where they're going to lose money.
What about you, Dr. Shetty? As the size of Modi Care is only going higher, do you think the operating leverage benefits will be filtered into margins?
See, as I said, we can't just talk about Ayushman Bharat alone. We have to look at about 30% to 40% of the current number of procedures done in every hospital, private hospitals mainly, are funded through financial intermediaries like Ayushman Bharat, ESI, CGHS, and the private insurance schemes and the company schemes. So essentially there is a financial intermediary. What has happened is two things which has happened. One is most hospitals have a huge outstanding from most of these schemes. That is one problem. Second thing is operation costs have really hit the roof. Price of everything in running the healthcare has skyrocketed. The minimum wages have hit very badly. Some states have increased the minimum wages to the hospitals double than what the minimum wages they have charged the industries, as if we are running a luxury industry. So all these activities, minimum wages is one of the big problem, electricity cost, importation cost, so everything has gone up. So targeting only Ayushman Bharat as responsible for the current problem is not really the fact. And I don't think even a revision of price by Ayushman Bharat will be able to compensate for the other problems what we are facing. But as we said, this is a phase of transition and things should only get better. We are optimistic that all these problems can be addressed.
Do you think a lot of hospitals have come on the forefront for expansion of the scheme?
Well, like I mentioned earlier, that we have more than close to 8,000 hospitals, private hospitals, which are part of the scheme, and we have large number of applications pending, and slowly as we are rolling it out, more and more hospitals are coming on board. So right now we are covering 40%, and if you include other schemes, government schemes, so probably it's covering about 70%. And there is a move towards some convergence between all these schemes, so at least we should have same packages, same rates, and same process, same IT structure, and when it happens, then 70% of the population will be covered through a variety of schemes which are working together. In that case, probably private hospitals will have to work with these groups, otherwise they are looking at only 30% of the market in the country.
Gentlemen, thank you so much for joining us this morning and sharing with us the latest developments there and the kind of impact we're seeing so far. Good to have you with us.